think it's important that the Trust has values and behaviours in order to provide the best quality of care towards patients.
Every patient deserves the right to be valued.
You treat people as you would like to be treated.
I think it just outlines the sort of people that we would like to have working at the Trust.
They should be the golden thread that runs through everything.
Values and behaviours are our commitment to both patients and staff. So if you're a patient coming into this hospital, you know how we're going to behave towards you, and this is our commitment to you as a patient. And again, this is what we're doing with respect to recruiting staff. We're saying, if you come to this hospital, this is how you behave, this is our value system, and you need to be able to demonstrate those values and behaviours to actually be recruited to work here and to care for our patients.
The ultimate aim here is improving the quality of care that we provide and putting patients at the heart of everything we do. So that's communication, that's safety, that's caring, that's learning, and that's respect.
It is about how we treat each other and our patients.
These are the values that we aspire to, whether you be a patient's relative, a carer or a member of staff or a volunteer, so that when you come into contact with Tameside Hospital, this is what you will experience, and these are the values that you will see in the staff caring for you at Tameside.
Values and behaviours are hard to explain, so having them written down in black and white makes it easier and accessible for every member of the Trust. If those values and behaviours are what they should be, then it's going to enhance your patient experience, because they're going to not enjoy staying in hospital but have a more pleasant stay while they're here.
It's really good having clear expectations of what we're all working to.
I think the values and behaviours are making a difference to the patients.
Patients have a right to be treated with dignity and respect, to be treated empathically, compassionately, you know, to be given the level of care that we would want to receive ourselves.
Safety within the A&E department is paramount really for patients' care.
Safety is very important, especially in our job. But yeah, it's for the benefit of everybody, isn't it?
People want a clean environment. You want to have a nice cubicle that is cleaned and well presented when you enter the cubicle itself. It gives a good positive signal towards patients that if the cubicles are clean and the equipment's clean, then you're going to provide a high standard of care for patients themselves.
Would you like a cup of tea? Yes, please, Brian. I'll have tea without sugar? No sugar.
Respect is the most important thing when delivering patient care, I believe, because if you don't give patients a level of respect when treating them, it can devalue their relationship with you and not be able to tell you everything that you need to provide the care for them.
If they don't show much dignity, you don't really respond in the right way.
My values are that I see that the patients are right, and that is part of the Trust's philosophy. Even a cup of tea sometimes helps, and a few words.
Hi Deborah, are you okay?
Most of the complaint we get out of our patient is that the communication was not enough or was not appropriate. And we are in Tameside trying to actually address that issue.
We do listen to our patients, we listen to what our families are saying, we listen to our workers. We do put actions into place and respond and feedback to the individuals, and hopefully by doing so we make improvements in patient care and in staff wellbeing and staff morale.
Staff communication it does help, it does make my stay here better. Well, you feel more relaxed, you feel more at ease.
I think learning in itself is very empowering, especially in terms of development. Whether you're a doctor, a nurse, a consultant, any particular level you're at, I think it's imperative that we continue to learn in order to become better people, and especially in the hospital setting, to ensure that we provide the best care to our patients. Working at Tameside Hospital for the best part of 2 years, I've seen a good number of changes occur, especially with improvements in teaching and care towards junior doctors. It's been phenomenal. I'm learning every single day. As a junior doctor, that's very rewarding.
All 5 values are important, but you know, the one that really resonates with me is care, because that's what I came into nursing for. I came in to look after people, to care for people, and there's nothing nicer than when you know you have a patient who's had a positive outcome, that's had a really positive experience.
From my experience with this hospital, they do care. They do care, whether it's the woman who's serving you brew on a ward, whether it's the nursing staff or the doctors or the ambulance drivers. I was always treated with dignity and with respect, and for that, me and my family are eternally thankful, because I am living proof that it does make a difference.
You know, every little thing that you do can make a significant amount of difference to a patient if it's done in the right way, you know, that you give the right amount of time and you give the right level of support. We're lucky to nurse. It's a very important task to have, and, you know, patients are putting their trust in us, and it's very important that, you know, we are caring and compassionate.
Clinical skills, anybody can be taught clinical skills, but values and behaviours I think are something that often comes from within and your personality.
I can see very positive changes now. Patients understand what they're going to get when they come to the hospital.
There is a lot of changes going on at Tameside, and I feel that the values and behaviours will play a massive part in that.
Well, we're on a huge improvement journey, and therefore this is a component of what we do in terms of improving quality, improving safety, and ensuring that we're a caring and compassionate hospital. So this is part of a larger improvement programme that's taking place across this hospital.
I'm a firm believer in saying that everyone does matter. Especially in a hospital setting like this, it's very important that we all work together as part of a team in order to provide the best quality of care towards patients.
Everyone does matter, because every patient who comes into the hospital should have a safe journey from admission to discharge, and they should leave the hospital knowing that they have had the best care possible given to them.
The staff, from top to bottom, they have a lot of time for you. They've got time to listen to you and take on board what you say. Things what may seem trivial, which are major to me, they can answer the questions that I've put to them. They make you feel human.
They're your core values as a nurse, to want to make a difference to patients and to want to deliver the quality and standard of care that a patient expects and should receive.